actually out to this conference. It's been quite stimulating. I took copious notes. I'm going to tell you a little bit about some work that we've been doing with a motley crew of people, which I'll introduce to you shortly, but give you some evidence of what we consider brain activity associated with optimal performance. Now, we can discuss at length what that actually means, and you might disagree with me on this. But let me kind of do a little pitch first. We actually, and the we I'll tell you in just a moment, we formed a Center for Optimization of Resources to improve performance, which we call OptiBrain. And what we're trying to do is to utilize neuroscience tools to uncover brain mechanisms that underlie optimal performance. And then, of course, once we understand the mechanisms, or hope to understand the mechanisms, how can we manipulate the mechanisms? So that's the two overall goals of this endeavor. And it's actually kind of a motley crew of folks. So this is me. Then it's Judy Swain. She actually shares two positions that are about 20 hours of plane ride apart, one in Singapore and the other one at UCSD. James Bauman, who is the psychologist at the U.S. Olympic Training Center. Then I work with Carl Van Orden, who's the scientific director at the Office of Naval Research and Naval Health Research Center, and also with Eric Potterath, who's the command psychologist at the Naval Special Warfare Center. So you can imagine we have some very interesting discussions when we meet. But let me give you an outline of what I'm going to be talking about. I'll give you again a general introduction of fMRI. Maybe you've heard it a lot, but I want to point a few things out. Then I will show you a pilot study, and I hope I get people excited about it, that we can do more of this work. And it is a pilot study. I don't want to overinterpret the data. And then I want to give you some implications of where we might go with this type of work. Okay, so let me give you a general introduction. So as we've been talking about at this conference and so at other meetings, we are now at a time where we can move basically psychology into brain science. And of course, you know, what we used to work on, what we're still working on, and has still validity, is that we ask people questions. We also do behavioral tasks. One of the things about asking people questions, and even though I agree with a lot of what Missy said today, there's one thing I disagree on, which is that actually, and people have done a lot of studies on this, if I ask you how good is your concentration, and I do a task on concentration or attention, your self-assessment is actually very poor in stating whether your concentration or attention is good or not. So there's virtually no correlation between what you say, how good you are, and how good you really are. And I think maybe on some level we're maybe saying the same thing. But now we also have other tools, and you know, I'm going to focus on brain imaging, but I want to fully acknowledge that there are a whole other set of tools that one could bring to bear to solve this problem. And the neat thing about brain imaging is that in some ways you get information despite of what the person that you're putting in the scanner is actually telling you. Now, again, just to kind of reiterate, what are we actually measuring with fMRI? And I want to, again, emphasize, we're not measuring nerve cell activity. We're measuring plumbing. We're measuring basically how the brain changes blood flow as a consequence of how active the brain is. And it's not just general activity. That's another important, I'm going to skip this. Another important element that we have to remember, whenever you show blobs in the brain like this one, without reference to what you're actually doing, most of these blobs are meaningless. So really, in a sense, what you want to, the way to understand functional imaging is what's the task that I'm doing and how does the brain respond to the task that I'm doing. So you could have the same activation in the same brain area meaning something totally different. So I think that that needs to be really kept in mind whenever we interpret these brain imaging findings. Okay, so now let me tell you about the pilot study we did. So we compared two quite somewhat incomparable groups of people, Navy SEALs and SDSU students, and we were asking, basically, this was the question, to determine whether functional brain imaging can even be used to identify brain processing differences between optimal performers, and in this case we termed optimal performers the elite warfighters, and comparison subjects. And again, you might argue, and we might want to have a discussion about this. To determine the effect size differences for future study, to elucidate the potential for fMRI as a tool to measure optimal performance. That's really where we want to get to. We're not there yet, but is this actually doable? And then to identify specific brain areas that may be targets for future modulation. So it's this was basically the goal of the study. Again, you may ask, is this really a fair comparison? And so many of the data that I show you may just basically hinge on a lot of other intervening variables, as you might say, you can see here. But this is the group of folks that we tested. The SDSU students were participating in an ongoing experiment that was really elucidating the neural substrates underlying emotion processing and anxiety. That's work I'm doing together with Murray Steen at UCSD. And then the Navy SEALs came to us from literally word of mouth from a research group that are studying stress on HPA axis. And they were, I have to emphasize this, they were off duty and off tour, so we did not interfere with anybody here. Now, I have to say, all of these individuals had been exposed to combat, and we did have additional assessments, and none of the folks that we do very comprehensive assessment. I'm not going to talk about this, but none of these people had evidence for PTSD. We have a bunch of other measures, which, again, just for the brevity, because I want to just get one thing across, I'm not going to present, but I wanted to tell you that they were slightly different in age, so we did all of the comparisons that I'm going to show you with age adjustment. Okay, so here's the task that we did. This is called the Emotion Face Assessment Task. It's based on work that was done by Ahmed Hariri and others. It's a very simple task. You have a target face and you have two probe faces. And the target face has a certain emotion. And your task is to say, okay, which one of the probe faces has the same emotion as the target face? So here have your kind of sourpussy looking kind of person, and then you basically have to say, is it the smiley face or is it this other sourpussy looking person? So basically here you would press the right button and I would tell you, yes, you're correct. And then as a comparator, and again, this is very important to remember for functional magnetic resonance imaging, you always need a comparator task. And often that's a very important step in helping you to interpret what you actually are seeing. This is a very simple comparator. This is what we call a sensory motor comparison task. You have here a couple of ovals, and you basically have to make an assessment which of the two shapes are the same. So basically we're comparing what the brain is doing this to what relative to what the brain is doing there. And we've basically did this in what's called a block design. Now I threw this actually slide in because I thought, man, I'm going to present to all these military people and they're going to look at me like, why the heck do you want to show them faces? But now I'm really glad I actually heard this morning that other people actually in the military think faces are important, which is great. But here's my reasoning. It has been widely used by many laboratories. So this is a task that's been used. It gets robust genetic effects, which I'm not going to talk much about. Our group has been shown previously that anxious individuals actually show increases on this task in areas that are important for anxiety. We've also shown that if you give an anxiolytic, make people less anxious, you get the opposite direction. We have some data that people with PTSD show reduced connectivity doing this, functional connectivity between two different interesting structures. And we also show that when you get depressed, your brain activation changes. So we have a lot of experience with this task, is what I'm basically saying. And now I can add to this from this morning, it's actually quite important to look at people's faces to do threat assessments, which is great. So let me go to the, this is just basically to tell you how we scanned these people. This was done at UCSD. The main issue that I want to highlight, we did what we call a structurally and anatomically constrained functional region of interest, where we focus primarily on three areas, the amygdala, the insula, and the medial prefrontal cortex, which includes the anterior cingulate. So I'm going to show you differences in those areas. Okay, so the analysis were all adjusted for age. I already told you this, multiple comparisons. Our main dependent measure, again, is the changes in percent signal during the faces minus shapes. And so I'm now going to show you what the task effect is, which is how do you actually process this task, and then what we call group effects or group by task interactions. Okay, the first thing that is important is to show that Navy SEALs are humans too, which means that they're processing something very similar to how the SDSU students are processing this task. And the nice thing about it is that it's a very robust task that activates what's called the fusiform face area. And if you just do it across faces, you can see very nicely very strong activations bilateral. So the red are the SEALs here, and the blue are the SDSU students. And you can see basically they look just exactly alike, which is nice. So we can show they're basically activated. Also, you get a nice task effect in the amygdala. It's actually bilateral, but I'm only showing you the right amygdala here. That's also important because the amygdala is an important structure for emotion processing. And again, you basically don't see much difference there. And I have to point out, these are sub-areas within the amygdala. So what we have so far is that both Navy SEALs and SDSU students activate the fusiform face area, the amygdala, and also, I didn't show you, but they also activate the insula appropriately to the task, as has been found in many other studies. So that basically shows you, yes, oops, oh, now I'm too fast. Now I have to go. Can you, getting too excited about the real effects here. So now I'm going to show you the group by task, the group by face type interactions. So the interesting part was we got basically three different interesting findings. The first is within the anterior cingulate, which is part of the medial prefrontal cortex. What we saw here is that whereas the comparison groups activated this area mostly to fear, the SEALs activated it mostly through happy. In other words, the kind of the emotion that was not threat related, as you might want to say. So there was a significant actually face type, target type by group interaction. And along the same vein, what we saw in the right anterior insula, whereas there the comparison groups activated mostly to the happy faces, the SEALs activated mostly to the angry faces. So the anterior inferior insula, the SEALs showed the greatest activation to the angry face. Oops, one back. Get too excited about this. And then the last task effect, where do we have it? I think that's where, no, I think we're down here on slide number 21. Okay, that was where I was at, and if I just basically not press so hard, so, okay, there we go. Okay, so that, I just showed you this, then, okay, here's the right amygdala. What we found there is actually a very similar pattern, except that here the SEALs had a much more profound deactivation, and this was in the right amygdala, to the happy and the fearful faces, but still a very strong contrast to the angry face. So we take this all together, oops, that where did they differ? The Navy SEALs relative to the SDS students show different emotion-specific activation in several top-down modulatory brain areas. In the anterior cingulate, there we found happy versus fear. In the anterior insula, where we found anger versus happy, and the right amygdala, where we also found greater sensitivity for anger. Okay, so now I want to put these results for you in some context. So the Navy SEALs show significant different top-down modulation of emotion face processing. So the top-down modulatory system are less influenced by fear, but greater focus on anger, and a greater attenuation to fear and happy. So how could we understand the differences? Well, let me actually tell you about the limitations now. So first of all, you could say, well, you know, there's so many different intervening variables. Clearly, we need a better comparison group. And we have other comparison groups that we haven't fully analyzed yet, but we need to compare them to other combat or non-combat exposed active duty personnel or other elite warfighters. This is also, it's a cross-sectional study. So we have no idea whether this is consequence of predisposition or acquired via training. So this is clearly something that we need to. Is this actually related to level of performance? So we need to have, now we have to have a performance measure. Does it make a difference? And what predicts the individual variability? Now, in this particular task, there really isn't a behavioral indicator of performance. We have other tasks where we can do this. And we don't really know whether, what the effect of combat exposure is in this particular group. So in this regard, with all of these limitations, can other studies help to explain what's going on here? So the anterior cingulate has been really involved in, has been mentioned in a number of processes, but is prominently involved in regulation of emotion. We know from work of many, many people that it is very critical for what we call action-outcome associations. In other words, you monitor for you monitor what's the value of different actions, and then you select among them. It's also been very much implicated in controlling controlling attention to threat-related stimuli. In fact, the area that we saw differences between the seals and the controls was exactly in this particular area. So that's kind of interesting. And also there's lots of work that basically has been recently summarized by Tor Wager that links this to this area to PTSD, social anxiety, and some other anxiety disorders. Plus, there's very strong evidence for the top-down modulatory role of this area as how it interacts with genetic background. So that's about the anterior cingulate. What about the insula? I love to talk about the insula. Insular cortex is really, I want to show you just a bit of our work, previous work. We've done a lot of work on risk-taking. And what we previously found is that this anterior right insula is really involved in risky decision-making. And actually, in fact, the degree to which it activates is related to how neurotic or how harm avoidant you are. But don't just take our word for it. There are now several other studies that have shown the same thing. In this case, it's just right is on the right side, and ours it was on the left side. But they've pointed out that this area is important for a loss anticipation, for how risk has to do with assessing how much loss you might incur. Now, the other interesting thing is it's also very much involved in urge processing. And urge means like how ready are you to act? So it turns out that there was a recent paper that got a lot of press that showed that people who have lesions in this area were more likely to quit smoking because they didn't have the urge to smoke anymore. And then a recent paper that just came out a week ago showed that if you had a strong urge to gamble, you had greater activation in this area. In other words, if you had a near miss, so this is a kind of a fun game. You have this one-armed bandit, and if you almost got it, the banana almost hit there, you get sort of this urge response and want to gamble again, and that's basically when this area activates. So we know that the insula is connected. Nothing in the brain works as an isolated piece. It's connected to various cortical areas, and is really critical for what we would call body state relevant valuation, motivation, and action selection, which is how ready you are, how ready does your body feel that you are. So basically what I told you is that we did a very preliminary pilot study. We showed some very significant effect sizes. I mean, I didn't go into the effect size differences, but they were quite significant between these two groups. There are clear limitations to the studies, but they're encouraging because they show us that there are emotion-specific differences between the two groups. But what we really need to now do develop a systematic program to basically address these questions. Is it state versus straight? What are the training effects? What type of optimal performers? Our next study, we're actually now looking at potentially doing some world-class athletes. We're working together with Eric on getting SEALs at various stages of training. And then the other question is what brain processes to study. Again, it's not sufficient that you just say, oh, the brain lights up differently, because the brain lights up differently for everything. It's really relevant. What are the critical brain processes that we want to know about? Is it emotional, cognitive, or potentially pain processing? So we've looked a lot at anticipatory emotional processes and also at decision-making and risk-taking. But that's basically, those are the next step of what we want to do. I want to thank you for your attention.
got there first. I assume you're familiar with Andy Morgan and Gary Hazlett's work on the sort of robust neuroendocrine markers of performance under stress, especially in the elite performers. So I mean, one, I think you stand to benefit greatly by adding a robust measure, looking at neuroendocrine status while you have these guys go through this. The second is really make sure you define performance up front. There's a huge debate right now during survival school. There's something called euphemistically the hard sell. One group of researchers has defined successful performance as essentially dissociation. That the best performers are the ones who go for a little vacation in their head while they're tossed around. Another group, and I think quite a little more reasonably and arguably, has defined successful performance as maintaining cognitive presence and acting like they're dissociating. And that's caused a real fracture, as you know, in the community. And I think it's really important you put that in right up front.
Yeah, I think well, first of all, I think you bring up a very important point, which is the degree to which optimum performance is a generic function, and whether the same type of processes go on in different under different conditions, and actually what are the specific processes. You know, is dissociation could be under certain circumstances considered optimum performance. Under other circumstances, it may be absolutely disastrous. So yeah, I think you're bringing up a very, very good point and being very specific on this.
Put it that way. Directions for the microphone. On your last slide, so you sort of lay out your manifesto for what you'd love to do, but we keep hearing back and forth about the challenges of resolution with fMRI. So world's your oyster. How would you get to the right level of resolution to do the sorts of things that you want to do that you laid out in your last slide and in your first slide, that vision?
Well, so I think, and again, I think this was pointed out before, is that fMRI is a useful tool to understand basic mechanisms. It's probably not a good tool to kind of keep your pulse. In other words, you need to then link it up with the technology that you can actually measure in a more realistic scenario. So I don't see these studies as being I see them as sort of basic studies to understand, okay, what goes on and how can we tap into the basic processes that make an optimal performer, and then how can we quantify these effects, and then how can we potentially with known training techniques speed up the process of getting people faster. So from my perspective, I don't see fMRI as a tool to get to measuring the direct kind of outflow of optimal performance, if that's what.
So it's not enough. It's necessary but not sufficient to say, you know, anterior cingulate is active. No, I think that's exactly right. Okay.
So for example, from my perspective, what I would say is if you are in that stage, and if I can track you, maybe then what will happen under the certain circumstances. So anterior cingulate is a good example. Say, for example, I can track that with error-related negativity, which is a much easier sample to get electrophysiologically. If this shows me that there's some relevance here, that if I can target threat-related activity in the anterior cingulate more sensitively, I may be a better warfighter, for example, then that tells me, okay, so now I can use another measure and say, well, let's target this, and let's see how well that functions with a now performance-based task. So that, you know, I show you a face that is not quite angry, and how sensitive are you picking that up?
Hi, quick question. I remember in one of your earlier slides, you showed the ages. What was the age of the college students?
Oh, those were in the early 20s, and the SEALs were in the mid-20s.
Okay, I thought you had 18 and 26, something like that. And I wondered, by looking at those ages, how is it possible that what you're looking at is sort of the adolescent mind versus the mature mind?
Well, if it were strictly an age-related phenomenon, we would have not seen any of these differences, because we did correct for, we did covary for ages. So if it's purely age-related, then we wouldn't have seen a difference. So could there be a developmental component? That's absolutely possible, and the better study is to absolutely match people on as many variables as you can. This was basically done on actually on no budget at all, because we didn't have any money to support this. This came out of basically pulling together resources from various places. This is not the optimal study for obvious reasons. But I think that, so what we did is do a post hoc correction statistically. That doesn't mean that there couldn't be a developmental component in it.
Thank you.
A couple of short comments. For the first question about dissociation, there is actually work which is done by Ethan Cross. Right now in Michigan, he just came from, I think, Columbia before that. CROSS. They're looking at the cognitive strategies of distancing, which is interpreted by many people as dissociation. There is a strong debate in the literature whether that's an effective strategy versus ineffective strategy, and as applied both to pathophysiology and activity. So you might want to, if that's of interest, you might want to follow up on that one, on Ethan Cross's work. The second comment is very short too. I don't think that fMRI resolution issue is the biggest issue, nor the weight, although it's about 7 tons. So I think the problem is really what parameters it delivers, and what parameters can be associated with performance, what physiological parameters can be associated with performance. So the resolution of fMRI are within seconds. Most of the psychological processes that we're interested in discuss today are within seconds. Some of them within milliseconds, hundreds of milliseconds. So the time resolution is not the problem. The space resolution is also not a problem unless you start going down into subnuclei and you are interested in that. The issue is not in the technique. The issue is the processes that we're interested in. Not anchors. So you cannot, so taking the ERP that you're talking about, ERN, right? And saying I can correlate the ERN with fMRI. Maybe, but the difference is that you're skipping 1 order of magnitude on the time scale. So you're really not reflecting the same process. And if you want to talk about processes, talking about minutes performance or hour of performance, taking something that has a very short time resolution doesn't help you at all. Quite the opposite. It just simply reflects your momentary fluctuations that you are not interested in.
Yeah.
So the question is, again, fitting the tool to the question.
The way I see this, so let me kind of go back to how we view this, the use of fMRI within understanding optimal performance, given the fact that, and I think you're quite right, that optimal performance itself has to be well defined. When I said that I don't think that fMRI will be a sort of you won't put it in the battlefield, or you won't put it next to the well, you might put it next to the training facility. It gives you a way of understanding what is the brain doing, and how can I optimally manipulate the brain. And so I see it as a way of looking under the hood of the car, so that I can find better way of fixing the car, or improving the car, or souping up the car.
It's a good analogy. It's looking under the hood to find out how to make the course the best performance. It's not, you don't know what are the under hood components that are absolutely necessary for the, for the race performance in a particular rally. So it can change. And I think this is exactly what we're talking about. We're looking on the functionality of a particular system, whether it's engine or transmission and all of that, and then we'll say, well, we would like to see some characteristics that will predict how the car will do in the rally.
Yeah. I think you're right.